Hi, my name is Jessica Cruz. I am a first-year Master's of Athletic Training student. On this MAT chat, we'll be talking to a sports performance coach and an athletic trainer to hear their thoughts about preparing athletes for the demands of their sport and how they feel they can effectively do that within their scope of practice. All right, so our first guest on the podcast is Coach Sam Schmitz, the Director of Sports Performance at Simpson College. Thank you for being here, and please tell us a little bit about yourself.
Yeah, first and foremost, thanks for having me on. But yeah, like you said, my name is Sam Schmitz. I'm the director of sports performance at Simpson College, Division III school here in Indianola, Iowa, about 20 miles south of Des Moines. Kind of prior to this, I spent some time down in Tennessee, at Austin Peay State University as assistant director of sports performance. Before I moved there, I grew up my whole life in Iowa. I'm from a small town, Missouri Valley. It's right by Council Bluffs, Omaha area. For those of you familiar with the area, I actually went to Central College. It's another small school here in the Des Moines area. Played football there, but really went there for strength and conditioning. Then I got my master's from the University of Northern Iowa in kinesiology, and then I spent some time at the University of Iowa with their football strength and conditioning program. And then, like I said, moved down to Tennessee. And then I arrived here in August of 21. All right, so just am now on year 3. So yeah, I got here in the 2021. I've been here ever since.
What sports do you currently work with?
So I oversee. So as a director, I oversee all sports. But I have an assistant, Matt, as well. And then I have some interns that help. So I work directly with football, men's and women's basketball, volleyball, and then I help with some of the track running stuff in the fall. And then Chinch takes over their lifting stuff in the spring. But yeah, those are the 4 or 5 teams I work hand in hand with. But I oversee all of them with the programming and all that.
Why did you choose to become a sports performance coach?
I knew very early on that I wanted to be one. I was never the biggest, strongest, fastest kid, but I loved being in sports. So I obviously knew I was never going to play at the professional level very, very early on, but I wanted to make sure I wanted to stay within the field for most of my life. So I kind of went back and forth with sport coaching, but then I realized I liked multiple sports, so it wasn't just one that I wanted to do. But then my sophomore year of high school, being the undersized kid that I just got done with the football season, and it kind of kicked me in the ass, to say the least. So I wanted to start lifting a little bit. So I found a guy that was training my best friend from back home, just in his basement, in his garage, had one Smith machine, one bench, some dumbbells. And from there, my love for, lifting and strength conditioning kind of took off. And then I very, very quickly learned that I wanted to be a strength and conditioning coach. So probably going to my junior year of high school, I knew I wanted to be a strength and conditioning coach. And then probably midway through my junior year, I knew I wanted to do it at the collegiate setting. So I essentially, I just kind of want to do what it did for me, because it gave me a lot of confidence that I never really had. So I want to make sure I can make that same impact with all the athletes that I have as well.
That's cool. I know why you guys rebranded to sports performance, but can you explain to everybody why you rebranded away from strength and conditioning and into sports performance?
Yeah, and something that's kind of it can go either way, strength and conditioning, sport performance, and people have different reasons why they call their departments what they do. But our main reason was we wanted to kind of teach athletes that it's more of a holistic view as far as success on the field, court, whatever it may be. Okay, so what that means, it's more than just how strong you are, how in shape you are, how fast you run. Like, there's a lot of other things that come into play when it comes to building the overall athlete. All right, so the first one's going to be obviously like your sleep, your nutrition, just daily habits that you're making. So we wanted to make sure our athletes know when they're coming in and train with us, that we're going to care a lot more than just how fast they are, how strong they are, and stuff like that. So again, it's kind of teaching them the holistic view, what it takes to become a successful athlete, both on and off the field.
Can you explain how you create your exercise programs and what goes into them?
Yeah. So we kind of use this term called reverse engineering. So essentially that's working backwards from the sport, right? So first thing we gotta do, we gotta know the sport, okay? Whether it's football, basketball, baseball, softball, track, whatever it may be. So we gotta know what the sport is, how the sport's played, like work to rest ratios, all that good stuff. From there, then we go watch their practice. Okay, so the sport might be the same, but the style of play that they do might be different from team to team. Okay, so for example, if I'm watching women's basketball, okay, I obviously know the sport of basketball. Okay, there's 2-pointers, 3-pointers, they play on X amount of feet on the court, stuff like that. Okay, but our women's basketball team likes to play man to man and get up and down the court. Okay, so I have to make sure I train them for that. Where a lot of other basketball teams might play more half court offense, defense, and stuff like that. So after we gather all that information, and then obviously the experience that we have had and knowledge we've had with those type of sports in the past, and then we finally put it onto a card, or the lifting program, you can say, and then we kind of plan it out throughout the year. And as far as the day-to-day goes, we want to make sure we're working the holistic body or the holistic athlete. Okay, we're not training bodybuilders, Olympic lifters, power lifters, and stuff like that. We want to make sure we're taking through all movement patterns. Obviously, those three things go hand in hand, okay, with getting bigger, faster, stronger, and all that. But we want to make sure our athletes know they are training for their sport. Okay, so our football guys don't train the same way as our softball girls do, and vice versa. Okay, some movements might be the same, but how we manipulate them and stuff like that, that's kind of where the quote unquote, for lack of a better word, sport specific training comes in, you could say. But yeah, that's kind of how we do it. Just kind of start from the sport and work our way back, and then finally put it all onto a workout card for them.
Yeah. Along with that, how do you determine if an athlete is prepared for the demands of their sport, would you say?
That kind of goes into the reverse engineering that I talked about. So within each sport, there's going to be different jumps you have to do, or a certain amount of distance that you have to cover, certain different movements that you're going to do. Like some sports do, more twisting than others, some do more cutting than others. So that's just obviously doing your research, okay, doing like I said, working backwards from the sport, knowing what they're doing, and then taking kind of an annual view of how you're going to progress into that. Okay, so very easy example of that is jumping, right? For the sport, let's say the sport of volleyball. All right, there's research everywhere that I can look up, from whether what I've done or what I've seen or what other schools are doing, of how much an outside hitter is going, how many times an outside hitter is going to jump in, a 5-set match, right? If I can know that number and program up to that, okay, and even sometimes a little bit beyond that, they're going to be ready for that demand. Okay. With speed work with football, it's a very easy example as well. Like I know how much top speed yardage one of my skill players are going to hit. Okay. So if I know that number, I can then start programming throughout the whole entire year and make sure by the time their season hits, they're ready for that demand or ready for that exposure. And that goes all the way down the list. Baseball pitchers, like we know how many pitches roughly going to throw throughout the year or throughout the day or whatever it may be. So we just have to make sure no matter what sport it is, what position you play, what demands you may have, we have to make sure we know those numbers, distances, yardage, whatever it may be, and we have to be able to map it out and program it as we go throughout the entire year.
You kind of already answered this, but can you explain what an injury and a biomechanical analysis is and how you utilize it?
Yeah, so injury analysis is pretty straightforward. It's a fancy way of kind of just breaking down the sports injuries, right? So obviously the most common injuries, how often they may happen, how much time you might have to take off, if you need surgery, if you don't need surgery. You can do that based off of your team's history. So now that I've been here at Simpson long enough, we can kind of look back the last couple of years with our sports. We're like, okay, football had a lot of knee injuries last year. Volleyball had a couple of ankles. Then we can kind of tailor our programming towards that. As far as the mitigation and the resilient side of things go. And then going off the biomechanical analysis, that's just like the kinematics and the kinetics of the sport. So kinematics, obviously, being how much cutting they do, sprinting, jogging, jumping, and all that stuff. Okay, and the kinetic of the sport is like how much force they're producing and given amount of time, power, velocity, and stuff like that. And then taking, again, all that, use the term reverse engineering. So taking all that stuff that we know and, again, making sure we're implementing into a card, into an annual program and stuff like that.
Along with the injuries, how would you say your relationship is with the athletic trainers there on campus?
I think it's good. It's definitely improved over the 3 years that I've been here. We're every single year, month, we're trying to get a little bit better with it as far as the communication goes. But we know they have a lot going on. We have a lot going on. I think on both ends, we're trying to put a little bit more of an effort of just over communicating with each other. But they're easy to work with. They're more than willing to take our ideas and vice versa. And I've said it from the beginning. Besides, obviously, relationship with your athletes and sport coaches, a strength conditioning desk sports performance coach relationship with an athletic trainer is probably the most important relationship he or she can have. If you guys aren't on the same page, a lot of things can go wrong. more specifically with the athlete safety. And I've been at places where the strength coaches have athletic trainers could essentially read each other's minds and know exactly what they want and what they're doing. And I've been at places where it's been the complete opposite, and you can definitely tell the difference. So I think overall here at Simpson, we've definitely improved. We still have some room to grow. But I think with, the numbers of athletes we have and the numbers of ATs and sports performance coaches we have, I think we do a pretty good job of it for sure.
How do you feel you can progress athletes through their return to play progression?
I think this is an area I've definitely improved on. Just again, talking to different coaches, see what they do, talking to our athletic trainers. Because when I first got here, essentially what we had was an upper body injury card, a lower body injury card, and then we had a spinal card depending on, someone can load their spine and stuff like that. And it pretty much was like one size fits all, right? So if we had two ankle injuries, they got put on the same single leg card. All right, now as we've kind of progressed, obviously, most people know there might be one ankle injury that's way more severe than the other. So now it's more of and we still have kind of our basic single leg card, single arm card and stuff like that, but now it's a little bit more specific to where they're at in the rehab. So I may have a kid coming off an ACL injury or surgery where he's ready to start doing some more bilateral movements and start building up some hypertrophy. Right, I might have another kid that's completely non-weight bearing, can only do single leg on his non-surgical limb. So something we've done a better job is kind of having the card and then making individual changes depending on where they're at in the rehab process. I think a big piece of that is we're starting to communicate more with the physical therapy our clinic as well. So I've been in contact with Athletico throughout the last couple of weeks with our ACL guys, and that's helped a lot as well.
What areas would you say you need to improve on the return to play aspect?
I think just more knowledge of what we can do in the weight room that they're not doing in athletic training room. Not that they can't or they aren't doing it, but they can't do it because of their space or lack of equipment or whatever it may be. So I think that's just something like just learning more things rather than just, all right, he or she can do body weight squats and the dumbbell squat, and then we can find them do a front squat. Like just looking for different modalities, whether it's, running or cutting, and like just different progressions and regressions with our change of direction or speed. So it's not just, okay, he or she's ready to jog. Now he or she's ready to sprint. I think just kind of finding more, steps leading up to that. Because I think as far as the weight room stuff, it's pretty self-explanatory. But I think there's so many more movement progressions that we can learn how to make down here as far as the running, cutting, and stuff like that. Because at the end of the day, that's the most important part, of return to play, in my opinion, is getting them on the field or court doing their sport with their cutting, their change of direction, their sprinting. So just kind of having more regressions and progressions with those type of moves, I think, is a step that we as a staff are starting to take and move forward, but we can definitely do a better job of it for sure.
Yeah. All right, last question. What role do you think strength and conditioning has in athletic training?
I think I touched on it a little bit, but essentially us just checking the boxes that they can't, or vice versa. Okay, so if we have a kid where he's kind of gone through all his rehab stuff upstairs and he or she is ready to start, putting the muscle back on or loading that single leg or loading that shoulder, that's when we can kind of step in as far as, what we put on their card, what we put in their run and stuff like that. I think another big piece would be obviously kind of depending on what level you're at and if you're tied to one sport or 6 sports, whatever it may be, is kind of playing a role at sport practice as well. Okay, so if our AT say, hey, he or she's ready to start doing some individual drills or some change of direction drills, as far as timing goes, we can take that kid off to the side and do some change of direction or some mirror dodge or some agility work and stuff like that. So I think if we can get to the point where it's like, hey, they've done, what they can in our room, they'll still get their basic treatment and stuff like that. But as far as rehab goes, he or she's now ready to lift or run or change the direction and stuff like that. Because I think we have a pretty good eye of, what a certain cut should look like or what a squat should look like and stuff like that. And then on the other side, the athletic trainers have a different lens. Okay, they might be able to see if they might have a better view if a kid can't hit external rotation or internal rotation or stuff like that. So I think kind of putting our minds together and doing all that and kind of letting us take over once they're ready to get on the field, I think that would be a big step for sure.
Yeah, that's why I wanted to do this podcast, is because I've noticed that there's like a big separation between strength and conditioning and athletic training when they can be put together pretty well.
Yeah,
And
yeah,
like
I
you
definitely
said,
agree. Yeah, and it's definitely it's a growing relationship no matter where you're at, because everyone believes in different things. You know, strength and conditioning coaches definitely have certain stereotypes as far as you're trying to play, and so do athletic trainers. So I think the biggest part is just sitting down with your staff, or with your sports med staff or sports staff, and sitting down like, hey, what do you believe in with hamstring injuries or knee injuries or whatever it may be, and kind of putting your ideas together so that you can just kind of have a plan in place. I think if there isn't a plan or step by step plan, I think that's when things kind of go all over the place. I think that's something that we're started trying to take steps forward with here is if I got a kid who hurts his hamstring, all right, what are the asking right here, what are the next steps and where do you want us to come into play? Like when do you want us to, take him over to start running, or when do you want us to take him over and start changing direction and stuff like that? That's kind of how I'm envisioning us kind of moving forward is kind of with certain injuries, like right now plans like ACL injury, labrum tears, or whatever it may be. Okay, what's the next 4 or 6 weeks look like? When do you want us to take over? When do you want us to do more lifting and stuff like that? Because it's definitely important. If you're not on the same page with your athletic trainers or vice versa, things definitely go kind of haywire, go all over the place.
Yeah. All right, well, those were all the questions that I have for you. I don't know if there's anything else you would like to add.
I got a question for you.
All right.
What did you learn most about, or what have you learned most about as far as the communication between athletic trainers and sports performance coaches?
So North Central is quite interesting. We don't have a strength coach.
Okay.
So a lot of the preparing athletes for the demand of their sport falls a lot on the AT, which I have a different experience on it because I worked with you guys for 2 years. So I think I'm a little advanced in that category compared to like my classmates, but I think it's like a growing field, so it's super important. And I've seen both sides of where you have a big AT like program, whereas Simpson had like a smaller AT program. It's just interesting to see how they both work and the differences
Right.
between them.
Right. And I think the biggest thing is for at all schools is just getting the help that, the departments need and that they deserve. It's hard to there's some small schools that have one strength coach in charge of 16 athletes or 16 sports and have two ATs in charge of those 16 sports. So I think, institutions and universities, doing their due diligence and kind of putting their money where their mouth is and paying athletic trainers and paying strength coaches, sport performance coaches will go a long way as well. Because obviously we know when we signed up to be an athletic trainer or sports performance coach, it's not a 9 to 5 job. You know what I mean? Like you're not going to work just a 40-hour week every single week.
Mm-hmm.
I think that the quicker both young sports performance coaches and athletic trainers can accept that and know what they're getting into. Okay, it's going to let them be a little bit more passionate in what they're doing and wanting to learn and grow a little bit more. Okay, and B, it's going to start putting a little bit more pressure on, administrators and stuff like that. They see these, coaches or trainers in the office all the time. Okay, hopefully it's going to pull their envelope. Okay, they're putting their work in. Okay, let's pay them a little bit more, then return, get them a bigger staff and stuff like that. I think that's the biggest thing I'm seeing with especially like young coaches. I don't really know so much on the trainer side, but just because I work with interns, is I always have a whole bunch of kids sign up for my practicum 1 class, all gung ho about it, and then first couple of weeks, we tell them if you're getting into this profession, it's 50, 60-hour weeks right away. You're not getting paid a whole lot. You might be in charge of 5, 6 teams and get paid $15,000 a year, and then very quickly kids kind of drop off once they realize that. But I think the kids that do know what they're getting into and are accepting that it's not a 40-hour week job, I think that's the first step. Like just getting that acceptance and then kind of taking pride in what you're doing, wanting to get new ideas from both strength conditioning coaches and athletic trainers. And then hopefully that kind of trickles, up to the administrators and stuff like that. So.
Well, thank you for taking time out of your day to talk to me and be on this MAT chat.
Yeah, for sure. If you need anything else from me, just let me know. It was good seeing you and hope everything's going well.
See you again. All right, our next guest on the podcast is Dr. Ben Colletti, an assistant athletic trainer at North Central College. Thank you for being here, and please tell us a little bit about yourself.
Yeah, thank you for inviting me. It's fun to talk about it. I'm really excited to talk about kind of the things that you've already told for me. Quick introduction of myself. I've been an athletic trainer now, finishing up my 5th year in total. 2 of them have been primarily with the secondary school setting, and then the following 3 were with collegiate sports, as well as some international and Olympic work in there as well. Primarily my athletic training journey is pretty similar to what most people do. I mean, I did my undergrad at Illinois State and graduated with my bachelor's in 2019. And then went on to do my doctorate in athletic training from Indiana State, which I finished that in 2021. And then that's what brought me to my current position here. In terms of some of the extra skills and things that I've gone through, I mean, obviously with the DAT, there's kind of an emphasis on some manual therapy techniques and some rehab techniques and things like that. But I have kind of a personal interest in injury prevention programs, data analysis and stuff like that. And based on some of the things that you kind of wanted to talk about today, that really piques my interest. So that's kind of, my journey of AT through to this point.
Okay. What sports do you currently work with?
Yeah. So, with it being Division III, we kind of have a format where, at any given point, we can work with any sport. But my primary coverages right now are with our men's and women's volleyball teams, as well as our women's basketball team. And then I also have primary coverage for both our men's and women's golf teams as well. But every once in a while, we'll work with every other sport, here at the college too.
Can you explain your treatment style and why you chose that?
Yeah. I think this is an interesting question because it has a lot of layers to it. For me, I'm approaching patients I'm attempting to try and be as patient-centered as I can, right? So patient-centered care, drives a treatment style, but I think it allows for, some differences between patient to patient. So, I'm not sure if there's a way to specifically describe my treatment style in terms of, I have soft tissue injuries, which means that a soft tissue injury is going to get this modality, that modality, these types of rehabs and things like that. But I think generally there are some things that I do lean on in terms of things that I'm familiar with, things that I feel like have garnered the best evidence and stuff like that. So I think just a quick hit on some of those, to me, rehab and resistance training and strength training is super important for probably any injury. I think when you couple that with some cool manual therapy techniques, whether that be some more advanced techniques like a mobilization, a muscle energy technique, advanced levels of like tissue release, or maybe not release, but tissue adaptation, like an instrument assisted work or a cupping work or something like that. I think pairing those together has some really cool outcomes. For me, like I said, I'm trying to be patient centered. And so if a patient's goals are the primary things of reducing pain and getting back to what they want to be doing or having a certain goal in terms of return, that's what I'm going to do. So that treatment style is very, very patient centered, like I said, and then it's really just trying to, collect some different tools in the bag to try and achieve those goals.
Well, you kind of alluded to this, but can you explain how you utilize exercise as a treatment form?
Yeah. I think for me, there's a lot of an emphasis on prevention. And so, in some of the sports that I've worked with, I've tried to collect some data as we go. I think there's some cool approaches to how we do rehab, or if you want to use the term of prehab right before somebody's injured. Exercise as a treatment is really just one of the most efficient ways to return somebody to where they want to be from a movement standpoint. I remember specifically there was an Instagram post where a rehab professional was talking and he said, if you want to get back from an ACL tear, if you want to prevent an ACL tear, train like you have one. And I thought that was really cool because, when you're at that, 8 to 12 month with an ACL repair, there's some really, really awesome exercise and really kind of awesome things that we see a patient do when they're trying to get back. And realistically, that's how someone should be training even prior to that. If you are healthy, hopefully we can be doing those high level things as we return back to sport, because we don't want to ever be leaving sport. So like I said, I think in the before, that's how we're kind of doing it. In terms of the after, I've really heard a lot of just great things in general about when you're trying to build back any type of structure in the body, whether that be, a bone structure or a soft tissue structure with muscles, ligaments, and tendons. The body needs to have some sort of external stimulus on it, and it has to be in a way that actually stresses it, right? We reference Wolff's Law pretty much in all like treatment and rehab, because we're trying to elicit that response of when a force is placed on something, it will build back to be able to handle that the next time that it's put on it. So when we're looking for the after the injury occurs, that's what we're trying to do. We're trying to load the structure in a safe way that doesn't cause further damage, but really facilitates that growth factor to try and kind of bring it back.
Can you explain how you utilize plyometrics to progress patients through their return to play protocol?
Yeah, it's a good question. Some of it, like I said, depends on what we're looking for. The demands of different sports have a difference in what they're looking for in terms of their plyometric ability or the ability to move something faster, right? But I think even at the core of a lot of different sports, that type of speed and agility is paramount, right? For me, working primarily with volleyball and basketball, if I can have somebody ready to jump higher or move faster or take a quicker step, that's an advantage. And obviously we're looking at patients that have a high plyometric output already prior to their injury, and then they're potentially looking to make sure that that's something that they can do afterwards. I think in the utilization of that, a lot of that is going to come a little bit later as we're returning. Like I said, there's a need to have load on the structure, right? And when we look at kind of like plyometrics and the basics of how it is generally talked about, you have 3 phases where you have some sort of eccentric loading phase that then goes into the amortization phase, which is that switch from an eccentric load to a concentric push, and then you have that concentric phase. If you have an injury, you need to make sure that you're safe to be able to go through all of those phases. So I would say that generally, if I am doing something plyometric, it is in the later phases of rehab, or it ramps up later in the phases of rehab. I think part of that is also just as I'm still learning rehab techniques and learning a patient, I want to make them feel really comfortable about some things first. So, like for example, if I'm doing a return to run program, there are parts of running that are considered plyometric, right? Because you're hitting and you're striking, and then you're pushing off right into the next step. And so when we're getting ready for a return to run progression, and we're looking at, okay, how are we looking to make sure that they are ready to do that? I might start with just a depth jump instead of a depth jump into a box jump, right? I just need you to step off and land, right? And I think that's that beginning part of kind of turning into, okay, now we're going to do a depth jump, and then once you hit the ground, I need to try and jump off the ground as quick as possible. So it's a really cool area that I think a lot of the times we forget about in rehab, because when we measure strength, depending on how we're doing it, if it's a manual muscle test, I wouldn't consider that a plyometric movement. You know what I mean? In terms of how they're creating that strength. Some people maybe equate plyometric measurements more to a power output versus a strength output, which you might almost say, like, what's the difference between those two? But I don't think that we'd have enough time to really get into that. But there would be some difference there. So, I think plyometrics are really important, especially just for me and what I'm doing. But I think even any other athletes can still benefit from it a lot.
Along that lines, how do you decide if a patient's ready to return to play?
I think there's a couple things that we can do if we dive into what we are, like I said, there's a couple ways to look at it. If you're looking from a injury and inflammation standpoint, we know that the phases of the inflammation cycle take a while, right? If we're really trying to heal the structures that we have, there's a lot of building and remodeling that goes for a really long time. And so that has to be something that we're considering when we are looking to get somebody back from any injury, whether it's surgical or non-surgical. Obviously, if you've got a surgery, you've essentially created more injury, right? Because you're opening up the body or using minimal incisions and things like that. But you are fixing something, so there's going to be that process naturally. So I think that's the first thing that's paramount in terms of consideration, right? There's a chance that if someone is really super strong and really bold, that they could attempt to do a squat 6 days after their ACL surgery. But that doesn't mean that they get to return to sport 2 months after their ACL surgery, just because they technically passed those things, because we know that that's a major risk to the actual structure of this, the actual structure of what has been repaired. So that's first off, right? In terms of the other things that we look at in terms of literature of how to interpret that and what then is a better way to return, that's when you start to bring in your other metrics that we measure, right? So strength, range of motion, and then some functional ability as well. So in terms of the strength and range of motion is pretty straightforward, right? We know what our norms are. We know what the contralateral side may be, right? We want to be making it as close to possible, right? We're also looking for them to be who they want to be. So if they want to be competing in athletic activity, let's get them to where they want to be. If they want to be just participating in really consistent activities of daily living, let's get them to that point. Because again, that's a patient-centered approach. So we go into then the functional movements and things like that. And there's a lot that's out there in terms of what is good and what might not be good to base things off of. I think it's easy to go off of, let's just try to talk about like some lower extremity stuff. There's hop testing, there's load testing, there's balance testing, and there's functional movement testing. All of those things, rely so heavily on the structures of the body that they give a really good picture of what you're able to do. I think that they're good, but there isn't a magic piece yet. And I don't know if there ever will be, because we have so many different sports in the world. We have so many different movements, and everybody has a different movement pattern. So I'm using those things. So to answer kind of the question in a long roundabout way, I'm using those things where we may do something like a Y balance test for a lower extremity injury. We might do something like some strength measurements with a goniometer, again, for lower extremity injuries. I'm looking for proper biomechanics. I'm looking for good landing mechanics. I'm looking for the ability to bear weight and shift weight, right? Yeah. It's a lot, right? There's a lot of things to look at, but I think hammering down to the understanding of relating that timeline of healing to what is suggested in the literature in terms of this is what someone should be returning. So looking at criterion, not just time, that's really important. So I think combining those two things is how I'm generally trying to prepare somebody to return back, but also just determining whether or not they should be coming back.
With North Central not having a strength and conditioning coach, how would you say you prepare athletes for the demands of their sport?
Yeah, I think it's it's an interesting thing in like the sports performance and wellness world, right? Or just any physically active population. There's definitely a thought that, oh well, if you don't have strength and conditioning, don't worry, our athletic trainer will make us a program, or they'll take care of that, right? That's not something that is maybe it's not something that's the best thing to do, right? Like there are certifications in strength and conditioning for a reason. I'm very confident in my rehab skills. I'm very confident that if you came and you said you wanted to get something stronger, we could work on it. But there are a lot of other things that I'm not sure that I have that in-depth knowledge of in terms of making sure that someone is growing or getting faster, bigger, stronger, things like that. So to kind of answer your question in terms of looking at the preparation for the demands of their sport, I'm really big on just looking at general movement patterns and collecting some data there. There's I want to make sure that someone is at least staying where they are, right? And making sure that if they are going to participate in a sport, that they have proper movement patterns for it and that they're not doing something that potentially leads to overuse injuries. So one thing that I've done recently, just to kind of trial out and see where it goes, is to just take some general strength and range of motion metrics. So for our men's volleyball team, we did like total arc of motion at the shoulder and strength at the shoulder in a few different directions, just to kind of track it across the season and see if it increases, if it decreases, if it stays the same, if it increases for some people but decreases for others, things like that. That just shows me things to be watching out for. It's definitely a disadvantage to not have a full-time strength and conditioning professional to maybe bounce some of that stuff off of each other, and that they can go and they can, measure what their max in a lift is, or measure what their cardiac outputs are, or measure what their vertical jump 40 time, 5-10-5 shuttle, like those types of things, It's tough to not have that, but I think, like I said, for me, I'm approaching it and just saying, do you have proper movement patterns? And how can I understand where you're at right now so that we can identify whether or not we really have to hone in on a major prevention program that focuses on strength or movement patterns in a certain way.
Yeah. Is there any areas you would like to improve on with that?
I think, yeah, I mean, for myself, I'm just trying to get more knowledgeable, right? I'm just trying to look at, one thing specifically for myself, like the sequencing of rehab exercises and how to go from one to the other. I have spoken with a couple of strength and conditioning professionals that I've met, in my network and things like that. And when I see the programs that they put together, it's so cool because they have a lot of like sequencing and timing pieces that I don't necessarily consider when I'm asking a patient to go through a certain amount of exercises. I have a general understanding of sets versus reps and things like that for whatever you're trying to get to. But it's so interesting when I see how they have like, okay, you should be 2 seconds down to the bottom and then a 1 second pause at the bottom and then a 1 second to get back up, followed by a certain amount of rest time. I think that's really cool because they're approaching it from a standpoint of how are you recovering in that moment, right? How are you replenishing the energy into your muscle systems, oxygen into your entire body, right? Those things are cool. So I think like that would be something that I'd want to improve on in terms of like the sequence and the, kind of like the sequence and the timing of the exercises.
Last question. What role do you think strength and conditioning has in athletic training?
I think the future of it is going to be really interesting. Obviously athletic training is a relatively new healthcare profession in its own way. And I think strength and conditioning has so many pieces in the healthcare world that if we as a society maybe had a little bit more of an emphasis on, physical fitness and things like that, I don't think it would be crazy to see strength and conditioning as just a main staple in the healthcare world, right? It should be, right? There, I mean, what strength and conditioning that realm has is a major contributor to injury prevention and wellness across musculoskeletal injury, but also just like gen med health. So I think that it has a huge role because it can touch in so many things, just like we as athletic trainers have been so proud of saying, oh, well, we have a little bit in each spot, right? We can do rehab, we can do evaluation, we can evaluate musculoskeletal and gen med conditions at a base level that allows us to refer out. To me, strength and conditioning has an injury prevention stance in all of those things as well. So I think that moving forward, the the two professions have a really cool opportunity to either have some major overlap or just have some really cool parallel function. You know, like I said, athletic training is a newer one and has only really had a certification for for a short amount of time. And we're getting to the point that strength and conditioning is going to require some level of a college degree with a certain accreditation to be able to take their exam for the CSCS specifically. So we're getting to that point where we want to really make sure that the standards for these professions are so down pat so that then we can actually establish a working relationship between the two. And I think that honestly, it's probably one of the coolest things moving forward. You know, injury prevention is going to be something that is so hard to track because it doesn't make you any money and it saves you phantom money, really. Like, oh, you didn't tear your ACL, and so you didn't incur the $8,000 in medical bills. And so you can never, it's not like you will then be given that $8,000. You didn't save, or you saved someone that money. You didn't make someone else, right? It's a tough standpoint. So I think that'll be a barrier, but those two professions moving together are gonna be able to create just some really cool things that I think hopefully society is going to be willing to appreciate more across general health and wellness as well as the musculoskeletal side too.
Well, those are all the questions I have for you. Is there anything you'd like to add or ask me about anything?
I don't think I have any direct questions for you, but I think, like I said in that last bit, just something to add is that, you know, if you're an athletic trainer and you're looking for another professional to get involved with, it doesn't have to just be another athletic trainer, right? Like look into your networks and reach out to other people, whether it's in physical therapy, who's had some really great crossover with strength and conditioning, whether it's into strength and conditioning, whether maybe you yourself want to go and seek out some strength and conditioning things, or credentials. There's a lot of different providers that will be able to kind of come together and make some really good impact. So I think that would be my plug to athletic trainers is like, let's not be too sheltered into our own realm and try and keep people out, but let's actually start to invite more people in, because then I think it allows us to do a lot of really cool things. Like I said, I've had the opportunity to work with strength and conditioning in like a symbiotic relationship where I don't have to worry so much about certain things because I know that a professional is taking care of them, and it allows me to do other things. It allows me to be able to focus in other areas of athletic training. And I'm not giving up my responsibilities, but I'm just changing how my time is prioritized. So that's my big plug to other athletic trainers and professionals, is to really start to do that interprofessional collaboration.
Well, thank you for taking time out of your day to talk to me and join me on this MAT chat.
Yeah, absolutely.